Okay. Hello, everybody.
Hello, you're
Hi, Mohan is a daredevil and he takes the toughest of cases. I don't know why he does it all the time. So for me, he has given me a small pupil.
Your case is also tough.
And I'm going to probably use a B-hex, hopefully. And this is I'm trying to do it in a topical anesthesia. Let me see if the patient cooperates. I like to finish it off with topical anesthesia.
So she's operating a small pupil with hard cataract.
Can you see the video?
We can see very well, Dr. Sujatha.
Thank you. Just need your feedback. That's all.
So she is going to use a BX pupil expander. This has been designed by one of our friends, Sujatha Bhattacharya. This is very good in comparison to balloon ring. You did not try to dilate the pupil the other way by the manual stretching, Dr. Sujatha?
No, I don't want to do that. Because I want to show. See, I don't use BX normally. I always use iris hooks most of the times, if at all. Otherwise, this size pupil I can even manage without any dilatation. But today, I'm just for demonstration purpose, I'm going to use a BX. And
B-hex means Bhattacharya hexagonal. Suven Bhattacharya has invented this device. We are very proud of Dr. Suven Bhattacharya. He had a very small room and he did the device in Kolkata in his own lab. We are very proud of Dr. Suven Bhattacharya.
This is the ring you can see.
It is actually
hexagonal.
It's a uniplanar device. It has got notches and flanges.
It's being marketed internationally also.
The alternate flanges go under the iris. It's a very nice device, much cheaper than Malavigin ring.
So first injected inside the antechamber. Now one by one she will bring behind the iris. This hinges you can see just to hold the iris.
Not listening to me. Very disobedient.
There are many rings available nowadays. One from the venue.
Actually, they have an injector. That would have been better, I think.
There is one ring from the Madhu instrument. This is Gupta ring that we are using. That is ring, the Meluni ring.
Much better if we use a BX forceps for this.
Yeah.
Yes, exactly. Last time I had it. This time I couldn't.
Hook hooks, it's very struggling procedure. But with BX forceps, you can hold the middle tab and easily place it under the iris. Sujatha, don't you have the BX forceps?
Yeah, we have. I had it. I don't know why they didn't give that to me. No. Last time he gave me. Kuglen kodu. And in the Kuglen sedilla. Okay.
Dr. Pradeep, since you like our own friend Suven has developed this expander, will you please tell about the material what they use to make this?
Yes, it is polyimide. P-O-L-I. Polyimide. M-I-D. Polyimide.
This is almost the price is 1/10, 1/6 price of Malugin ring. So you need to select the cases, as Sujatha said, that some of the patients with a very small pupil, if you want to plan for want to go ahead with the monofocal intraocular lens, then best is iris hooks. But if you want to go for a premium surgeries, then I think the BX expander will really have a good hand in this one.
But we should have a BX forceps. Otherwise, with Kuglen hooks, it becomes.
They are special forceps for it, made by Suven. So if we use that forceps, that is more convenient. But Dr. Sujatha told that she is not using regularly this ring.
This one I'm not using it regularly.
Yeah, I know. Iris hooks are always better because we are more familiar with that iris hooks.
Huh? What I'm going to do is I'm going to use
She
iris.
wants to demonstrate
on-
because she has been asked to do the pupil
Yes,
extender.
yes. It's better
Can I change over to my iris hooks?
Yeah,
You don't
ma'am.
mind?
Most welcome, most welcome.
Thank you.
This is the
That's not
this is
going
the
in
thing
fact.
which we should learn from Sujatha, that if you have any issue, you should not have an ego. Ego has no role. You have to give the vision to the patient ultimately. So if any issue, you just shift to the thing which you are more familiar. Because we always try in the OT many things. Whenever we go back from the conference, we start new technique. And
It's a couple of times I've used them, but last time I remember I used an injector, but I don't know this.
yeah,
time-
ma'am.
Hmm.
Injector and the special forceps.
Yeah.
So,
And I-
but if whenever we try new things, we are learning from, we are not having any fellowship now for us.
yeah.
Nobody invite us. So we have to learn our patients. But whenever we have any issue, we just convert to our basic techniques. So this is a take-home message from this surgery that she has now how easily and comfortably and rapidly she is doing the surgery now. You can see because she has shifted to her basic.
Sorry about that, but one thing you saw was that how easily it came out.
Sorry, this is just a learning for all of us.
No. At least it showed that how easily it goes in and comes out. Only thing I think I should have practiced a little bit more if I'm going to do BX.
Just want to make a comment.
Hmm.
In one of the IRSI meeting I went,
Hmm.
and I was very hesitant in showing that I am using iris hook
Mm.
because I thought that this is the meeting of cataract refractive surgeons. And I was so surprised
Mm.
that everybody was using iris hook. And BHAC somehow in my hands has not worked well.
Karan coming.
It is very difficult to put.
We-
I have tried many times, but I have not been.
Yeah, I agree with Malay. Now see how well the people are dilated. So old is gold, no doubt about it. How beautifully the people has got dilated. And now the surgery is a cakewalk for her. We welcome Dr. Rajendra Prasad after doing the wonderful surgery. We welcome Rajendra Prasad in the hall. Rajendra, you have a mic nearby you. You can comment whenever you want. Dr. Harsh.
We also-
Dr. Harsh is our president, sitting next to you. So whenever you want, you can comment anywhere.
we also-
Malay, thank you very much for your expert comment.
Also welcome Malay Chaturvedi.
And keep after this Chennai surgery, we are going to shift to the Dashti.
Yeah, Anurag is ready now.
Ek- uh,
So after completing the rixus, I'm just doing some hydrodissection. It's not a very hard cataract. So the primary purpose was to show how to deal with small pupil. Sorry about this. I think
You just go-
I
go
think
to-
Santanshu, you should be more comfortable, and ultimately what is important is the patient has a good outcome.
that's right. Actually, if you have a post-uveitic cataract and a small pupil, generally they have a
Once.
yeah,
Okay.
pupil is not the sphincter is almost spasm. So putting these
என்ன போட்டிருக்கு?
expanders is not so easy, and especially as
அந்த
you have
மாதிரி.
seen the BHEX. BHEX is a little flexible. You need a little more force in uveitic cataract. So it's as she has done, it's beautiful. Like she has put these hooks, and hooks would give you much better control while expanding, and as well as you get a good
நீங்க
dilatation
மாத்துறீங்களா?
of the
சார்
pupil.
காமிக்கிறாங்களா? சார் மாத்த சொல்லிடு. They want to see. ஏமா டூ வைமா முதல்ல. I want to remove the air bubble.
This is probably a 15-degree tip, is it?
I have to remove the air bubbles. There are too many air bubbles. I'm using the Galaxy Leo also. So
really wonderful surgery. See, now bus, the things are,
Mohan Rajan is just.
the Mohan Rajan has just completed surgery.
yeah.
Now we are shifted to the Dashti.
No, no, can you see my, okay.
Yeah, Mohan. Wonderful done.
இப்ப என்னம்மா காமிக்கணும்?
Dr. Kudlu,
After finishes, I'll show the.
if you have a, but I'm here. Here, look at me. Front, straight here. In the hall. Where are you looking? Me here. If you have an extension of the anterior capsular tear,
stop பண்ணவே இல்ல.
especially like as you have seen in the previous case, so what would be your approach?
ஸ்டாப்பே பண்ணல.
Not here. RP.
We are shifted to,
Shifted to 3D.
so Mohan has completed his surgery and Sujatha also completed surgery simultaneously. So we are now shifting to
3D surgery.
Thanks a lot to Dr. Sujatha and Dr. Mohan for joining us.